Hi everyone, welcome back to all my listeners. This is episode number 7 of season 9. Today is Wednesday, June 14th, 2023. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, you guys, just another friendly reminder that Anchor has now become Spotify for podcasters. So please go ahead and continue following my podcast on Spotify as well. Please show me your continued support and loyal listening of my content-rich value-add podcast on the Spotify platform as well. Now, I've gone ahead and provided a link in my show notes for you to use to go ahead and continue showing that loyal support of this Paint the Medical Picture podcast. Now, I know there's lots of you that already support Spotify when you make your own music playlists, right? And Spotify has expanded and they have podcasts as well. So just go ahead and search for Paint the Medical Picture podcast, and it is available on Spotify. Now, all right, you guys, I just got back from an amazing professional retreat that was put on by my podcast sponsor, Advanced Coding Services, and Beth Schleeper. Now, it was 3 days of really outstanding information presented by trusted leaders in the industry. So, of course, there are shout outs that need to go out to my good friend, Betty Hovey, as well as Christine Hall, that I've had on my podcast in the past. And of course, I'm going to be bringing on other incredible speakers from the retreat, and I want to share with all of you conversations here on this platform. So it was absolutely fantastic. It was in San Diego, California, and it was simply spectacular. So just wanted to share and shout out to those fantastic speakers. Now, anyways, you guys, today's Newsworthy is going to be featuring, of course, all the news and the goings-on in the month of June so far. So I'm going to encapsulate them in my very popular grab bag session. And then in today's Trusty Tip, I'm going to be focusing on gender-specific services and compliant billing recommendations. And of course, I'm going to go ahead and close out today's episode in Spark with a remarkable quote on success by Coco Chanel. If you guys have checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and our valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help all your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts, and definitely start following this podcast on Spotify as well. I really love your support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and my compliance recommendations based on my over 12 years of experience in front office, in back end, in coding, and in billing for multi-specialty physicians, in compliance, and in auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. Today's episode is sponsored by Advanced Coding Services, a leading medical billing and medical coding school in the United States. Whether you're just starting out or a seasoned professional, our training equips you with the tools and support you need to advance your career. Our medical billing and coding school meets your needs worldwide online or in person with one-on-one support throughout your training. We are committed to helping our alumni and credentialed medical community in keeping up their certifications by offering various avenues for acquiring your continuing education units. In addition to our Mastering the Business of Medicine retreats offered several times throughout the year in different parts of the country, we now offer memberships. You can conveniently earn your CEUs by attending our exclusive members-only webinars. Since our aim is to nurture and grow the careers of individuals who work in the business of medicine, we call our member area the Apple Orchard. Advanced Coding Services, educate, nurture, inspire, reaching back with a hand up. So let's get into Newsworthy. Today's Newsworthy features my grab bag and the first is about the fact that the state of Florida has amended the Florida Electronic Health Records Exchange Act, which essentially bans specific healthcare providers from offshoring or sending overseas certain patient healthcare information. This act is slated to take effect on July 1st, 2023. So please be mindful and ensure that your patient information is being stored accordingly as of July 1st, 2023. Now, our qualified licensed healthcare providers that are affected by this act include our physicians, physician assistants, acupuncturists, chiropractors, podiatrists, naturopathic physicians, optometrists, nurses, pharmacists, dentists, speech pathologists, occupational therapists, nursing home administrators, dietitians, athletic trainers, and massage therapists, as well as many others. Now, also affected by this act include licensed facilities as well as providers furnishing mental health or substance abuse services, along with their respective clinical and non-clinical staff who support inpatient and outpatient services. Even further, there are specific facilities and related service providers who are also affected by this act, and they include our hospitals, ambulatory surgical centers, nursing homes, assisted living facilities, pharmacies, and home health agencies. Now, moving on, my second newsworthy grab bag is all about the new JZ claims modifier. That's J as in Jill, Z as in zebra. And that claims modifier is for certain Medicare Part B drugs, as well as the affected providers who are included are the physicians, are the hospitals, as well as those ambulatory surgical centers, and those providers who bill Medicare administrative contractors are MACs for Medicare Part B drugs and biologicals from a single dose container or from a single use package for use in their Medicare patients. So make sure that your billing staff know about how to compliantly bill for the modifiers JW and JZ. So using that JW modifier, that's J as in Jill, W as in water, that is used to show the amount of drug that's been discarded or wasted from the single dose drug containers or the single dose packages. So that's only, again, be mindful for the drug wasted or the drug discarded from that single use or single dose container. Now moving on, the reporting requirements for the new JZ modifier, again, that's J as in Jill, Z as in zebra, that starts effective July 1st, 2023. Now, some of the background on that JW modifier includes the facts that when a provider or supplier discards or wastes the amount of the Part B drug or biological that was unused from the single dose container or unused or wasted from that single dose package, Part B does provide payment for that discarded amount, as well as they make payment on the dose administered, up to the amount of the drug shown on the vial or the package labeling. The discarded amount is any amount that is not part of the prescribed dosage and is not intended to have a therapeutic effect on the patient. Now, since January 1 of 2017, CMS requires uniform use of the JW modifier. Again, that's for that drug amount that's been discarded or wasted when processing Part B claims for drugs and biologicals from single-dose vials or single-use packages. So you must remember to be mindful and document the exact amount of the discarded drug in the medical records of Medicare patients. Now, the final rule in calendar year 2023's Medicare physician fee schedule also established a requirement that you report the new JZ modifier, which is for the zero drug amount wasted, which means nothing was discarded, nothing was wasted. And CMS also states that the JW and JZ modifier requirements would apply to separately payable drugs under Part B that are supplied from a single dose container and from a single use package based on FDA-approved labeling. And effective July 1, 2023, you must report the JZ modifier on all claims that bill for drugs separately payable under Part B when there is no discarded amount, when there is no drug wasted from those single-dose containers and from those single-use packages. But for the amount that you do administer, you should go ahead on the claim line. You should be including those billing and payment codes, such as that HCPCS J code for the drug, and describe the given drug, as well as append that modifier JZ, which shows that you did not discard and you did not waste any of that drug, as well as include the number of units you did use when you administered the drug. So use that number of units in the units field on the claim form. There are no changes regarding the reporting of the modifier JW. And finally, the third newsworthy grab bag today focuses on the State of the Union just weeks after the PHE lifted on May 11th, 2023. Now, there are over 500,000 people that have been disenrolled from Medicaid since the PHE ended. Many did not complete the enrollment process forms. Many did not know they even had to respond to the renewal request forms, and yet many do remain qualified for Medicaid coverage since they had no change in income. A specialized enrollment period has been open since March 31st and is quickly closing on July 31st, 2023. But despite this, there remains continued confusion and lack of clarity on the renewal process for this vulnerable patient population. And now, it's time for my best practice tips in Trusty Tip. So in today's compliance tip, I wanted to focus on compliant billing practices for gender-specific services. CMS may reject or return Medicare Part A and Part B claims if it appears there's a mismatch between the procedure or diagnosis code and the reported sex of the patient. This is a reminder to institutional providers and clinicians that bill for Part B professional claims that a condition code or modifier are available to allow these claims to process correctly. So, effective July 1st, 2023, the National Uniform Billing Committee revised Condition Code number 45 to gender incongruence, which is defined as, quote, characterized by a marked and persistent incongruence between an individual's experienced gender and sex at birth, end quote. So, for any procedure codes often considered appropriate for only one gender, indicate on the claim detail line if the patient's experienced gender is different than their sex at birth. So, for claims to process correctly, specifically for our institutional providers, continue to report condition code number 45, which is for ambiguous gender category, for inpatient and outpatient claims related to transgender, intersex, and gender expansive systems issues. And then for our clinicians that bill for Part B professional claims, report the KX modifier, K as in King, X as in X-ray, for any claims related to transgender, intersex, and gender expansive systems issues. And finally, I focus Season 9 Spark on success. I want this 9th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for success in all we strive to do. So, in this week's inspiring quote in Spark is from Coco Chanel. Don't spend time beating on a wall, hoping to transform it into a door. Absolutely true, right? I think this is an amazing quote that reminds us that there are many ways to find success. We do not need to keep making the same efforts again and again if those efforts fail us time and time again. This quote inspires us to let our creativity shine. This quote reminds us to trust our own instincts. We do not have to follow the pack. This quote inspires us to stand out, to be truly unique. This quote inspires us to create paths of our own, to create new doors of opportunity that lead to our success. I'm happy Coco Chanel's spark still shines on in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. So in my final note today, yes, that's right. It's all about mental health. Everybody should be taking that time out each and every day to just find time to see some sunshine, smell the roses, get outside and de-stress. Take a walk, get away from that computer screen and those devices. All of those electronics should be put away and do something fun, do something in nature, just decompress. So again, I'd love to see your emails coming in to me about how you unwind. I've received 3 so far, so I would like a lot more to discuss how everybody out there is finding ways to take care of themselves. So wish you all a very, very happy week ahead and less stress-free than the week before, right? So thank you guys so much for listening in on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.